Welcome to Disruption Dialogues Podcast Season 2. Listen to the influential leaders and trailblazers from around the world as they share invaluable insights to navigating the fifth industrial revolution.
Hello, and welcome to another episode of Disruption Dialogues Season 2. I'm Siddharth Saha, Senior Vice President with the Healthcare and Lifesciences Practice at MarketsandMarkets. And today I'm in conversation with Dr. Jochen Hurlebaus, Head of Digital Health Innovation at Roche Information Solutions. The topic for today's discussion is collaborative innovation, ensuring health service delivery excellence. And I'm excited to have Dr. Hurlebaus, who brings a wealth of experience. Now, we are all aware that healthcare is a complex sector, while also very personal and local when considering cultures, behaviors, economic and regulatory angles. And digital health solutions is not entirely new. It's been on the agenda for several decades now. Jochen, how would you explain why out-of-the-box products and solutions are not always the perfect solution for every scenario in healthcare?
Yeah, first of all, thanks, Siddharth, for having me on your podcast. It's a pleasure and an honor to be here. And yeah, digital health, it's such a topic which has received so much attention, especially during COVID. But then you really see very often that even a truly innovative digital health solution doesn't really disrupt a market or doesn't gain a lot of traction beyond maybe one individual market or setting. And I think the reason for that is that it's just unbelievable difficult to actually scale these markets into different, or these solutions into different markets, because there are many hurdles to do so in the systems, but also in the funding workflows. And we just have, as you mentioned, all these different local regulations, clinical workflows that are very, very different, even from one hospital to the next one. And then we have solutions which are just offering a specific functionality which is not fitting into these specific needs. So, well, one could say, why don't we just build a solution that has a lot of features and is configurable and can be just adapted to the customers? But that, I think, is also not really a winning solution. We can take the example of electronic medical records in that space. These things are really big animals, and they can be configured to almost everything. But the disadvantage then is it's like a huge change project to implement them. You hear very often hospitals saying, it will take me another 2-3 years to implement my electronic medical record system. So during that time, I don't even have time for any other innovation, any other digital health innovation, just come back in 2 years. So we also see that there is an issue here when it comes to these huge complex solutions. Now, I'm not saying that electronic medical records are not helpful. Actually, I think they are necessary to build kind of the basic infrastructure on hospital provider settings to actually even make innovation in digital health possible, right? You need to have some kind of a backbone. You need to store your data somewhere. You need to have the basic connectivity. But for true innovation, I don't think an electronic medical record is really built for that. And the reason for that here is that if you look where these systems are coming from, they are coming from more like the billing workflows. So how do I basically center my processes in the hospital to get paid for it, to make sure I have the right service delivery recorded and documented so I can actually get paid and secure my revenue. Now, when we talk about digital health, we want to look into patients. We want to look into what is the individual patient having, what is all his medical data from his previous history. Well, that is very often not even stored in an electronic medical record, because the electronic medical record is centered around the provider. And now we're talking about patient-centric. So we need also a different way of approaching this solution. And that is just not possible with an EMR. We need to be more patient-centered. So the real disruption, I think it really requires exactly that. Let's refocus around the patient to provide solutions that are actually tailored to the needs and to all the different needs of patients for different diseases, acute diseases, chronic diseases, in different cultures where they're just also treating patients differently. So I think at the end, it's kind of this, what I think you also once called the quintuple aim in healthcare that we're really looking for. And that needs to be patient outcome, patient experience. But still, we shouldn't forget about the clinician experience and, of course, the reduced healthcare cost. The fifth element, and I don't want to forget about this, and it has luckily actually gained a lot of attendance in the last years, is the topic of health equity. So these 5 elements, I think that's what we should really aim for. And that's where digital solutions have now to think about, how can I make this happen? This is a very complex, very broad set of needs that we have in these different markets.
Interesting, very interesting, Jochen. And obviously the purpose of today's discussion was innovative approaches in building very specific capabilities. And we're going to spend a few minutes on that. Now, just before we get there, you talked a little bit about the various stakeholders on the ground who are involved, right, in the selection and the choice of deploying, using digital health solutions. Now, it seems that, and it's quite clear across healthcare in the eyes of the CIO's team, as well as the user groups, the saying, less is more, is becoming very important. And if you think about different clinical scenarios, different workflow situations, so many different applications that are available and doing a good job, we must admit. And the layer of all those regulatory pressures and risk of data breaches, and it all points to a very complex and a very busy ecosystem, or environment, if I may say so. So in your views, what are the various aspects of digital transformation that needs to be addressed, in terms of steps, stages? If you think about the entire journey, there's got to be better ways of doing it. So what's your view on a better way of doing things?
Yeah, I think you're totally right. I think the CIOs are overwhelmed, as well as the clinicians, and maybe the clinicians even more so, because you have to think about, what happens if you have point solutions from individual companies that you as a physician or clinician or a nurse practitioner have to actually use and recommend to your patients and explain to your patients day in, day out. And all of them are different. They have a different usability concept. They have different types of buttons and whatever they use. That is just an impossible thing to do. And on top of that, you have a lot of small companies that are, actually, maybe startups, maybe not very established companies that you don't even know, are they still around 3 months from now? And now combine that with one more complexity, that whatever you do in a provider setting, in a hospital, it's always a change process. It's not just, I'm going to install a little IT solution and then tomorrow it's going to be used. No, you have to go through changing the processes, training your employees, taking certain measures to reduce the risks of these new solutions. So it's a whole big process. And it just doesn't seem feasible to do that like 100 times for all these new digital health innovations that are coming around the corner every day. And then in addition to what I just mentioned, small companies might not be there anymore. You might not even be able to trust them because you don't know them. They don't have a brand value. So for me, the solution therefore is clearly on platforms, right? I mean, many of these entrepreneurs and these startups obviously have a very good solution, and they're doing a great job on innovating on, let's say, an AI analytics for image analysis or for analyzing certain data from the patient. But why should all of them build their own backend solution? Why should all of them take care of data security, privacy, and rebuild all of these basics that you need to actually deliver your innovation and bring all of this individual 100 times to the same hospital? So here the platform actually is the one that I think can solve the solution for the CIO, but also for the clinician and the physician, because when you start going down that route, you say, I have a basic infrastructure and that is flexible, just like on our smartphones, what we see, right? I have certain infrastructure there, and then on top of that, I can install a lot of innovative solutions, and it's very simple. And I can even enforce a certain usability standard. I can provide toolkits. And so suddenly the situation becomes one that is feasible for and easier for the innovators, but also for the users and the payers.
Mm-hmm. Jochen, you touched upon the platform. I mean, clearly, there's hundreds and hundreds of very innovative solutions that have been built. Some work very well in isolation. Some are dependent on the adjacent system or solution because they're reliant on data, feeding into their system. And there's this phrase in the industry that innovation should not be the monopoly of a few, right? So why do you so strongly believe that an ecosystem approach or a digital health platform, innovation platform, is key to continued success? Because you used a phrase, there's many startups with brilliant solutions, but we're not sure whether they'll be around in a few years' time. And obviously, we want sustainability, we want resilience, we want these brilliant solutions to stay around. So how would you explain that an ecosystem approach or a innovation platform based development process ensures longevity? You see, that I'm interested in that angle.
No, and it's a fair question, because you could indeed say, well, I mean, what you're saying doesn't even that block the innovators from going to the market, because now you have somebody that controls a platform and that wants to control everything. But I don't see it that way. Actually, I do see it exactly the opposite. And why is that? Because at the moment, the reason why these startups and entrepreneurs are failing is because of the go-to-market, is because they don't manage to get their solution into clinical practice. And the platform allows them to do exactly that. So then they can basically hop on an existing solution, and within a very short time, they can go to their first customers and they can start using their solution. So this is the enabling factor that emerges. And so basically the startups and the entrepreneurs can fully focus on their solution and their innovation and creating then the clinical evidence out of that. They don't have to bother with all the difficulties that so far have actually, in my opinion, be the main reason why digital health has not taken off. It's just that the distribution is so difficult. And now, of course, I don't want to, neglect the risks that are coming with such platforms, right? That you have, let's say, one platform player that is so dominant that suddenly that platform player can also basically prohibit certain innovations to come to the market. And hopefully, I mean, healthcare is so complex and it's so diverse and there are so many applications that I see the risk not so high, because I would see that we will see multiple ecosystems. Some might be more focused on hospitals, some more on ambulatory care, some might be more focused on imaging or specific diseases, cancer, diabetes. There could be many different ecosystems that overlap. So that's also the entrepreneur and the innovator has a choice which platform to go onto. But yeah, of course, you have a certain risk that a dominance of platform owners will kind of have some negative side effects as well.
Absolutely. And Jochen, you're associated with Startup Creosphere, a global innovation platform. Can you tell us a little bit about the vision and the objectives of this approach?
Yeah, sure. And so when I started the Startup Creosphere concept at Roche, I was convinced that we indeed need to bring together the innovators and entrepreneurs of this world with the big corporates, because the innovators have the innovative ideas and they have the passion, and sometimes they actually also have a value already created because they have access to a specific data set, to a specific algorithm coming from a university, where there's really a very high value. But then the corporate has all of these other things. And in our case, it was not just a specific IT platform when we started. It was basically we as a company that have a lot of knowledge and market access and customers around the world. So we started to bring together startups with the Roche colleagues. And the first thing actually that emerged was exactly the idea about a platform-based ecosystem. And handheld device, in this case, that's what one of the topics we started with, where the Roche colleagues saw, oh, wow, there's so much innovation. If I use my handheld device and I open that up by making it an app store type of concept, just almost like a smartphone, I can tap into all this innovation and I can help these little startups to actually then scale with our instrument. So that was exactly the idea. So we did that for a few years and now merged into really using the startup criosphere concept to attract the best startups that are fitting onto our platforms. The handheld device being one, but we have a few other platforms. And I think what we do goes a little bit beyond just selecting and putting them on our platform. I think the key that we do in this 3-month program that we have twice a year, so we run twice a year, a 3-month program, is that we look at the innovative solutions, but we use then our expertise to help what are potential gaps on the regulatory side, on the medical evidence side. So to help the external startup and companies to identify that and help them how to potentially solve that. While of course, they also teach us something, right? It's always a give and take. And also the learning experience for Roche is actually a significant one because we see how they approach these new solutions, what kind of new tools they use that we might not have thought of. So it's actually a very equally balanced learning experience that we have. But the ultimate goal is to really feed the innovation to our platforms and then to the patients and physicians of this world.
Thank you for that. Jochen, I get the feeling we must spend some time later on, perhaps another episode where we look at some of the success stories coming out of startup criosphere. Now, Jochen, you touched a little bit about, supporting the SME community and these entrepreneurs and these aspirational companies with the rules and regulations and governance and all of that. We can't end this discussion without touching upon, the regulatory and governance mandates that are obviously important in the sector. In your view, are there any mandates, rules that need to be changed or simplified? Because everyone seems to be burdened by the compliance and the need to meet these rules, right? So are there some things that are very obviously can be targeted to be simplified or changed?
Yeah. So, I mean, I think, and that's of course an advantage of bigger companies. So we do have enough manpower to have regulatory experts for many or most of the countries in the world. And so I do think it's a manageable topic for larger companies, but of course not for a smaller one. And I think what is probably the one point that I would mention from a regulatory perspective is less diversity might be good, right? Because even if you look within the European healthcare space, it's so diverse that it makes it much more challenging and not very efficient to go into all these different individual little things. From a governance perspective, I would see actually a bigger need to do something. And I think for me, at least when I look into the European space, I think the US has done that already many years ago, having not even a strict mandate to say, well, you got to follow certain standards, like a smart on fire standard, a data standard. You got to have APIs so any patient in Europe can, through whatever tool they use, access their healthcare data easily, and not with sending a letter or an email to the healthcare organization and you get back like a CD-ROM or some unreadable image file where you need an extra browser for. I mean, this is just so outdated. So I think having certain governance or government mandates on data exchange and access, that would be tremendously helpful. I think it would also create an ecosystem for innovation, because you would suddenly see that small companies leverage this access, of course, with patient consent, and offer solutions for patients, and suddenly you'll see a multitude of innovations happening.
Absolutely. And do you think the procurement process, specifically tendering, should those processes also change, so that the needs of the enterprise or the health system can be met, and not just the targeted solution area? Should the whole procurement process also be changed forcibly top down?
Yeah, I think that procurement is another interesting topic, because at the moment I think it looks sometimes pretty like on a combined offering of many features, and then sometimes you just add on certain features, and then you have a very complex tender that only runs every 5 or 7 years. And that is in a world where digital solutions come out every few months that are really helping and disrupting the healthcare system. It's just not probably the most, it's not helping innovation and change. So I think here there would be a change helpful, and maybe it should exactly be on that end of saying, well, I tender for a platform because that's my basic infrastructure, and then I tender very quickly individually. The platform you don't change every day or every month, but of course your individual solutions you should be able to add on quickly based on needs and what's happening on the market very fast. So yeah, I think it would definitely help innovation, while not reducing any of the stability or increasing the risk for the patient in this case.
Great. And finally, Jochen, what's your outlook for the future in the area of digital health?
Well, I'm obviously optimistic. Digital health will make its way. There's no way around it, and it's going to disrupt healthcare how we see it today. I think it's going to be very much patient-centric. Recently, a few times, people asked me, when will the computer actually make really the decisions and not the physician? And I said, well, that's probably going to happen the day when you will not be allowed to drive your car yourself anymore, because the self-driving car will be so much better that nobody can say, well, okay, I'm still driving myself. So let's see when that day is coming. It might be far out, but it might be coming sooner than we think. So
you seem to be a believer in let the machine decide a few things, let the machines take over.
Partially, yes, not fully, of course, but in some aspects it might at least be good to have the machine giving you a suggestion, and then you can still decide yourself.
Yes, assist, give you all the options, outline all the best case scenarios, provide all the information, and basically a prompt, while the clinician or the business partner can make the ultimate decision. Yes. Great. On that positive note, I would like to thank you, Jochen, for spending time with us on this Disruption Dialogue. Thank you so much for an interesting discussion, and thank you everyone for listening in. I was in conversation with Dr. Jochen Hurlebaus, Head of Digital Health Innovation at Roche Information Solutions, and stay tuned for such interesting Disruption Dialogues. Thank you.
Thank you very much.
Thanks for tuning in. If you want to know how you can navigate and thrive in this disruptive era, subscribe to Disruption Dialogues on your go-to podcast channels and stay tuned for more interesting episodes.